we record it so we can share it with system partners as well. If you've never been to Lunch and Learn before, this is some initiative between the ICB and Linker about offering providers quick access to experts on certain different subjects. This is our 9th Lunch and Learn. And some of you, if you've been in our SONA work, will have recognised Jane. And Jane is one of the stalwarts behind the excellent work around oral health, specifically as part of SONA. And one of the things which we talked about is reiterating some of the key components around SONA, but also introducing people to best practice around oral health in general. So I'll leave it to you, to Jane. I will do my best to. So just to give clarity to everyone else, is that Jane will do a presentation and then there'll be Q&As at the end of it, and then we'll as the Q&As stop, and if there's no more questions, that is the end of the session in a nutshell. So if you can keep your questions to the end, I think that might be more helpful for you, Jane.
Yeah.
And I will monitor the chat, and I'll also monitor any hands up if you want any questions asked when we've finished your presentation. So over to you, Jane, to share.
Fabulous, thank you. I will just share, hopefully. I have to apologise, I'm doing it from the clinic today, and I've only got one screen, so I'm feeling very, very lost without my screen. So it's just loading up now. Apologies, it can take a while. There we go. Marvellous. Everybody, is that okay, Mark? You see the screen okay? Fabulous. Thank you. Good afternoon, everybody. Thank you for just so like Mark said, I'm Jane Johnson. I'm the Oral Health Improvement Manager for Lincolnshire. We have a small team, yet growing team. We've now got 3 other practitioners, myself, Holly, Krista and Emma. So we work for Community Dental Services. So I'll just give a very brief overview for those if you haven't heard of us. So we're the Community Dental Services, and we are a referral only service. We deliver high quality care for those that cannot be treated in a high street dentist, be that with mobility issues, anxiousness, disability, secondary, sensory needs, anything like that, who you would be referring people into. We also offer like sedation and general anaesthetic. We also do a domiciliary service, which some of you that might have used within your own services. As I say, the clinical team is an extremely small service as well. So it's not always like freely accessible. But if anybody wants to ask any questions about referring at the end, please do. So I've just put a little warning slide on. Some of the slides are quite graphic, just because we're going to talk about dental caries today. So I don't want it to be too squeamish, considering it is a lunch and learn. So our key messages for any oral health are really basic. We brush twice a day with a fluoride toothpaste, most importantly, last thing at night. We brush for 2 minutes. We spit, we do not rinse. We reduce the amount and frequency of sugary foods and drinks, and we visit the dentist regularly or as often as they recommend. So that could be anything from 6 months to 2 years. Sound easy, don't they? But trying to support others to do things like this, that's not an easy task. So what we've decided to talk to you today about is like the dental caries. So hopefully then you've got that kind of background information and knowledge to why you're delivering that, like excellent oral care, as you all, hopefully will be doing. So it's just to give you that little background knowledge on that. So oral care, as you know, it doesn't just affect the teeth and gums, the roof of the mouth, the lining of the mouth and the throat, the tongue, the lips, and obviously salivary glands. And it's those salivary glands that have that really important job of producing the saliva that flushes away any debris of food and keeping our mouth in a nice neutral habitat. So there's lots of things that can alter that, but one of the things with people that are, you know, on long-time care, long-time medication is the salivary glands slow down and they're not producing that saliva. So again, that can cause dental decay. The reasons why oral health is so important, we think that it's for the overall health, for the prevention of pain and suffering, to ensure that they've got adequate nutrition. So people that have got toothache, you know, mobile teeth, or they've got loss of teeth or poorly fitting dentures, them to be able to, you know, eat the nutritious foods and also be able to speak, socialize, that can, you know, all have a very negative impact if the oral health isn't good. And, you know, just that general quality of life, you know, because a healthy smile, it boosts people's confidence. You know, if you're looking after somebody and the teeth, you know, they've got, you know, like poor oral health, the teeth haven't been brushed for a while, the more at risk of getting things like, you know, bad breath and things like that. So just a simple brush can make all the difference. So how oral health is related to our health and well-being. So we're just going to talk a tiny little bit about this and then get into the dental caries. But again, it's all because it all links in. The mouth is our gateway to our body, you know, so things like oral cancer, diabetes, heart disease, strokes, it's all affected by what goes on in our mouths. Things like tooth decay, gum disease, and obviously bad breath, they're, you know, these are things that we can deal with. But what we want to do is ensure that you've got the methodologies behind it so you can help prevent anything from the bad breath, the gum disease and the tooth decay. And then that will help the rest of the things that we've got on that slide as well. So dental decay, what is it? So it could be called dental caries. There's a number of terms, but, you know, if we'll class it as dental decay. So dental decay happens when the enamel and the dentine of a tooth becomes softened by an acid, and it happens after you've eaten or drunk anything containing sugar. So just to make it kind of a little bit more of a bigger picture for you, the enamel, so that's the lovely, hard, shiny surface of our teeth. That is the strongest surface in our body, strongest substance in our body, sorry. It's stronger than any bone. It's like on par with the ivory of an elephant's tusk. It's strong stuff. So if you think that any like fizzy drinks or overconsumption of sugary things can affect that and create holes in that, you know, that's quite a strong effect that's having. So if you can just see the little Venn diagram there, what we've got there is we've got the tooth decay, and all the things around it are the things that cause tooth decay. So we've got a tooth, okay? The tooth is something we do not want to get rid of. We want to keep that tooth. To get tooth decay, we need sugars, we need bacteria, but there's also that time balance. So what we can do is we can reduce the frequency and amount of sugars. So that leads into the time, and the bacteria, we can reduce that by brushing. Okay, so like I say, it does sound simple, but this is why that reducing the frequency of sugars and you know, making sure that brushing is thorough and that twice a day can all make such a big difference. So one thing that you guys might see quite a lot, especially if you're looking after like older persons or people that have had a prolonged, you know, like lots of dry mouth, prolonged poor oral health, is something what we call root caries. Now, I do apologise, the picture is dire. So what I would encourage you to do is search root caries for a much better image. It's just that we haven't got licensed in for one, but I'm going to try and get a picture off from one of the clinicians. So with root caries, it's caused by the bacteria and obviously this high sugar, and it can develop really easily and really quickly because, as you can see, the nice shiny enamel, let me see if I can get my little pointer. So the top surface here is that nice shiny hard enamel. As the gum here, the gum line lowers, so where the darker patches is now, that should be hidden under the teeth. Under the gum, sorry. So the gums have worn down, and the shiny enamel, the really protective bit, that ends at the neck of the tooth here. And then once it's all under the bone, it's got a much softer substance called dentine. So when caries hits the dentine, it eats through it so much quicker. So with any food debris that's left around the gum line, it eats away at it really quick. And what can happen with root caries, because it's not got that protective enamel, it eats through it quick, and then the teeth become very, very, they get a very, very narrow root, and then they break off very easily. So that's why we see, and if you can just make out on the back of the picture, and I apologise, it's tiny, the teeth have sheared off right at gum level, and that's the reason for it. So when we've got a high diet, you know, lots of like sugary sweets, sugary drinks, it's constantly getting the teeth in like kind of like an attack mode. I've got a little better explanation coming up. There's other things that can happen to our teeth. So this is like dental erosion. So this is where the surface of the tooth gets worn away. This is due to like a lot of acidic foods. And then there is another one called abrasion, and that's with brushing your teeth too hard. So, but this one here, the erosion, is lots of acidic foods. And this could happen if people are kind of like, you know, they're more in a supine position if they're eating it, and it's like pooling at the back of the teeth, shall we say. So it's like constantly hitting it. And again, it just words through that lovely, hard, shiny surface into the softer surface underneath. And what happens then is it mushrooms underneath. So this hard, white, shiny surface, if you can see down here where it's more yellow, any decay is going to kind of start there, and it will mushroom underneath. So the tooth may look sound, but it might start going a little bit grey, and that means that that decay is like kind of like starting underneath. But all things like this are preventable, obviously, by, you know, like reducing the sugars and the fizzy drinks in our diets. Something like that isn't reversible because it's already had the damage done. But, you know, we can stop it from that where that is now. This is also caused by, you know, high sugary diet. So this is obviously a lot more extreme. We do see this. It isn't uncommon. The staining isn't an issue, really. The staining could be, you know, that just could be from years and years of, you know, high staining foods or smoking. They could just have a more naturally darker tooth. So it's not the staining as such, but it's things like, you know, the decay here. And you can just see how thin the teeth are looking. You can see those little circles on the top of the teeth there. That's actually the roots, the nerves that's going down. So they would be at one point very, very sensitive. I would say by that picture, those teeth would have died off. I think that's kind of gone a bit too far, but we can stop it on this first picture here and prevent it from getting any much further like that. Again, just by changes in habit and what we're drinking. Another condition that can cause dental decay as well. It's a condition in itself. It's called gum disease or gingivitis. So again, we can prevent this from getting any worse. When we get this, when it's just at this stage, if you can just see there's just some of like the sticky residue just around the teeth, and there's like the triangles of a darker colour gum against the nicer, healthier, lighter pink colour. If you were to put a toothbrush on that, it would bleed. And what a lot of people do is it says, oh, it's bleeding, I don't want to brush it anymore, it's a bit sore. Or, you know, especially if you were caring for somebody and you put the toothbrush on and they bled a lot, it can be quite, you know, a bit traumatic, thinking, what have you done? Have you hurt them? It's not. They've just got a little bit of infection. The body doesn't like it. So as soon as you're touching it, it's kind of like wants to free itself of all that. So what we need to do in that case is actually brush a bit more, because what can happen is this residue that's sitting around the teeth, that can then eat away at the enamel as well and cause dental caries. So then you're left with gum disease and dental caries, which really is a recipe for disaster. So with gum disease, obviously the gums change that colour to go a much darker pink. They do bleed on brushing, and they can recede. So when that means like they start going, as you can see on that one, the gum line should be about there naturally. if you can just see my cursor, and just that little triangle at the top is where they've got that more of a darker yellow. So that just shows that neck surface down, that dentine is on show. Gum disease can also cause bad breath and a bad taste, so it could put people off eating certain foods and drinks. Gum disease is also when it progresses, that changes into a periodontal disease, and that means that the bone's been affected. So that then is when we get mobile teeth and tooth loss, because you could have some people that have got the most perfect teeth, no dental caries in them at all, but they're not looking after the gums, and then they will lose the teeth because of gum disease. So trying to explain what I was talking about before about keeping our teeth nice and happy. So if this was a perfect day, and I don't really know anybody that would have a day like this, but in a perfect day, our teeth can take 3 to 4 acid attacks. So when we eat anything with like high sugar, high carb and things like that, that's what we're calling about our acid attacks. And the teeth start dissolving away. So as you can see, after three meals, the teeth are only in that danger zone for a very, very short time. If we were then to look at possibly a more normal day, shall we say, so we'll have our breakfast, might have an orange juice and a biscuit, in between. Then at lunch, we might have a muffin, a cake. Then lunchtime after that, we might have our coffee with a couple of sugars to perk us up for the day, and so on and so forth. So your teeth are going to be under attack for a lot of the day. Okay, our teeth won't like that. And that's when they're at risk of, getting dental decay. So what we want to do is look at these in between foods and drinks. So if we could change them to be sugar-free, then that would keep our teeth into those 3 attacks a day. So just as reference, as an adult, our maximum, so it's not a target, it's a maximum, is 30 grams of sugar. So that equates to about 7 cubes a day. So if we kind of have that in mind, and if we're spreading that out between our meals, we can try and keep what's in between our meals sugar-free. So it can be a bit of a minefield, and we do get asked about what about no added sugar drinks and the fizzy drinks. So obviously the fizzy drinks, if you can think back to that picture of erosion, that's what that would cause. So even if it's got no sugar in it, so like your Pepsi Max and things like that, it's the acids in them that can cause a lot of damage as well. And if you are having the cola, that does have a staining effect as well. Anything with, it might say no added sugar, but if it's got fruit juice from concentrate in it, that is actually a sugar. Because when we eat fruit as a whole, so a whole apple, a pear, a whole apple, banana, something like that, the sugars are enclosed in a fibrous cell. So when we change those, so we either macerate them into a smoothie, turn them into a juice, dry them into a raisin, those sugars are then released from their cells and become what we call free sugars, and free sugars are the sugars that are damaging to our teeth. So anything with fruit juice from concentrate, because that's got a natural fruit that has been changed, is going to still damage our teeth. So there's a lot of clever media in how it's sold to us that you're thinking, oh, it's fine, we're having free, sugar-free. If it's got anything from fruit juice, from concentrate, and other things like honey, your syrups, all things like that are going to have sugars in them as well. So just because they're not called sugar, so it can make a difference on what we're giving in between. If we always say there's no never foods. We just have sometimes foods and drinks. But if they were going to have, if they did that kind of fizzy pop and juice and things like that, keep them to the meal times, have them all at meal times, and then look at what we can, provide between meals. So water, plain milk also helps to, they're healthy for our teeth. But if they are going to have something fizzy, maybe have a little sip of water after, just to help that neutralization. if possible, something like a sugar-free chewing gum, a little piece of cheese after it. It just all helps to get our mouth back to that neutral stage. What we wouldn't recommend is having something fizzy or sugary and then brushing your teeth straight away. That's like kind of throwing like an acid on your car and then cleaning it. It's not going to do any good at all. So we always recommend that brushing teeth 30 minutes before or 30 minutes after eating, because when we brush our teeth, toothpaste is naturally abrasive, and then, you know, that kind of softens the enamel a tiny bit, not as much as fizzy drinks, but it's also got products in it that then help to strengthen it. So because they're still in a little bit of a sensitive stage, when we've brushed our teeth, we need to leave it that half hour either side. Toothpaste and toothbrushing. So like I say, we brush twice a day. Most important time is last thing at night. So the reason for that is overnight we don't produce as much saliva. And remember, I mentioned before that saliva does a fantastic job of removing debris and helping to neutralize our mouths. So it doesn't matter any other time. So if you've got somebody that is really, you know, fractious in the morning or just not happy, it doesn't matter. We can brush the teeth at midday, you know, as long as it's twice a day, and the most important, last one at night. That's the most important things for us. We just want to be using a pea-size amount of fluoride toothpaste. You can see the ingredients on the back of your product, and fluoride is a mineral, and that just helps to keep your teeth nice and strong. For those people that don't want fluoride, that's fine. What I would recommend for them is that their diet is, you know, extra meticulous, because the fluoride does help to give that protection as well. And we always recommend that we just spit out after brushing and we don't rinse. We want to keep that fluoride on our teeth for as long as we can. Hence, we don't want to be eating or drinking within the half hour, but as long as we can leave it on, the better. So again, for that, but especially for the overnight one, you know, try and brush the teeth after they've had medication and things like that, that you want to just keep that fluoride on. It does help protect the teeth overnight. And just something as simple as that will make a big difference. I know it's difficult when we're talking about all these things and it's like, well, what happens because we haven't got a dentist? Any acute pain or anything like that, you can contact 111 for advice. I have put a barcode on there that links up to the ICB. It used to have a list of dentists within Lincolnshire that were accepting patients for pain through the 111 service. However, I've looked at it since and that bit seems to have gone. So, but if you call the 111, they will give you a list of dentists that you could call for advice, guidance, and hopefully get some treatment as well. So again, our key messages, simple, but they're not. So again, it's just that brushing twice a day, fluoride toothpaste last thing at night, brush for those 2 minutes. If you can't brush for 2 minutes, brush as long as they can, okay? And even if you want to add an extra brush in to kind of make it that 6 minutes through the day, that's fine. Reduce that amount and frequency. So, you know, if you are, you know, like caring for those and they do like the mints, they do like the, you know, like the cakes, the fizzy drinks and stuff like that, a little bit of water after, or a little, you know, something that can help get the mouth back to a more neutral, you know, a tiny bit of cube of cheese if that's possible, especially if they're on, you know, like build-up drinks and things like that. A little sip of water after, it just helps to remove that residue, and we can help get the mouth back in a healthier environment much quicker. And like I say, if people have got a dentist, please encourage them to go. They are like gold dust at the moment, but there is a lot going on across the county to help to you know, to get more dentists into the area. And as I say, and it is all about prevention. You can see a dentist every day, but if you're not following these key messages, you will still get dental caries, you'll still get gum disease. What we need to do is what we do at home is more than 80% how it's going to stop, you know, stop them. All a dentist can do is treat what they see. So it's our job to keep everybody in the best oral health condition that we can. So I don't know if there's some references for you. I know Mark's going to send the slides out for you so you can see all that. If you wouldn't mind, I know it's like a bit odd, but if we have got a feedback form, so once you've got all your slides from Mark, please feel free to send me any feedback. We do always act on it. So if you need, well, you know, or if you've got any ideas on anything else you'd like to cover, please let me know.
Okay, we do have a question already in the chat for you. So
Yeah.
there's a question from Stanley. It says, just about clarification, when is the best time period to brush in the mornings, before or after breakfast?
It's a personal, I always brush before breakfast. So I get up, shower, brush my teeth, and then have my breakfast later on. But I know a lot of people like to brush after the breakfast. So as long as it's either 30 minutes before or 30 minutes after you're eating, it does depend on your day and what you are. So as long as you've brushed well last thing at night, it doesn't matter. As I say, there'll be, I'll say before, but another colleague always says after. So it's whatever fits in with yourself.
Okay, has anyone want to ask a question? You can put it into the chat, or you can raise your hand using the emoji at top of the screen. I'll come to you. Quick question. This is something I know the answer because we've talked about it before.
Yeah.
The use of mouthwash.
Oh, okay.
So when is the best time to use it, and when isn't the best time to use mouthwash?
So mouthwash, it's a really good adjunct to brushing. So we do recommend, you know, it's something that we do recommend. We recommend using it at a different time to brushing. Mouthwash has got about 220 parts per million fluoride, where your toothpaste has got 1,400 approximately. So if you're using your mouthwash immediately after brushing, it's a bit like putting hand cream on your hands and then washing them. What we want to do is we want to keep that toothpaste on as long as you want. Personally, I like mouthwash after lunch. It freshens the mouth and it gives them a little boost of fluoride. And then just as long as it's at a different time, it doesn't matter. But I do think it's a really good adjunct to do, as long as it's non-alcohol. You make sure that it's alcohol free, because when they've got alcohol in them, they're very drying. So just check on the ingredients. Try and stay away from things like Corsadil and like the chlorhexidine ones, unless you have been asked to use them by a dental professional. The Corsadil is you can get Corsadil daily, which is fine, but the normal Corsadil is a treatment mouthwash, so it's short term only, stains the teeth horrifically, and that is a job for a dental professional to clean off, and it's a really tough job because I used to work with the hygienist, and we can see it a mile off if people have used Corsadil long term. It's a 7-day maximum, and that's only if you've got a gum issue. You know, they might want you to use it after you've had a tooth out and things like that, but any of your normal mouthwashes like your Listerine, anything like that, as long as it's alcohol free and it's got a bit of fluoride in it, great after lunch. But
Right,
pick me up.
We've got another question. Basola's put something: if someone declines, what do we do?
There might be many reasons for it. They might be, if it's a constant decline, you could always try somebody else. They might have a more preferred person to do it. Record it. Record everything. Record whether you've brushed the top, the bottom, the left, the right, whether they've declined, because then the next person coming to see them can then, if you've only brushed the bottom, then the next person can start on the top. And so at least they're getting the mouth clean that day. We can't force people, but we could maybe look at the reasons why. They might like a different toothbrush. They might like a different flavoured toothpaste. One that we're using might be a bit spicy for them. We could offer them, gently coax them, just kind of like put the hand over hand and like mirror them, and there might be reasons why, if they're wincing or anything like that, they could have toothache or something, so it might be worth getting them checked out as well. But that would be my best response. We have got I can give you loads of information on it. Yeah.
Then we've got another one here from Stanley. What's your take on charcoal toothpastes?
Yeah, they're very abrasive, and what a lot of the kind of aimed at like getting rid of staining. So something that a brush that can get rid of stain, a toothpaste that can get rid of stain, and what it does is it roughens the surface of the tooth. That makes it more porous, that makes it more open to stains. So you use the toothpaste more, and it's then a vicious circle. I would just recommend any fluoride toothpaste, doesn't matter what flavour, what brand. It could be Lidl, it could be anything. So yeah, I'm not a huge fan of like the homeopathic ones, because they haven't got the fluoride in, and we do need that fluoride to help support our teeth. I have got a list of so there's a product in toothpaste called sodium lauryl sulfate, and that's what makes them foam. And a lot of people, especially if they've got a dry mouth, that can irritate them a lot, and especially if they're like peg fed and things like that. So if we use like a non-foaming one, but I've realised on this list that Lidl's Dentalux is SLS free, so it's a nice cheap one. And so if you want, I can pass that to you, Mark, the list, and then
that'd be great. That'd
be a good one, a resource for you.
Something I'm surprised one was asked is about dentures.
Oh, okay. What about cleaning dentures?
Yeah, best care of dentures, because historically dentures and social care goes in hand with horror stories sometimes. So because we've got a number of providers on the call from home care rather than the care homes themselves. So you will have people in their own homes who no respect to them, will have their own views of what they want, and they will want to soak their teeth overnight and things like that. So just very briefly, says best practice things to look out for, things to be aware of, especially with dentures which can be worn and be not looked after in the past, so they could be at risk of faults or breaking.
They could be very brittle, because the cleaning solution, so like your tablets that you put them in, if you do read the back of them, they do say like 10 minutes, 3 minutes max. So they're not designed to be used overnight. So if you can, I mean, the newer dentures don't even need to be in water overnight. They're very resistant, but you could put them in for 10 minutes and then put them in clear water overnight. So you're still following the wishes and putting them in the cleaning solution, and then they just need to be cleaned either over a sink full of water or over a towel, anything that's not gonna, if your denture fell, it's got something to break its fall, because dentures are very, very strong until they're dropped, and we don't want to break them. They're a precious commodity. Brush them with a soft toothbrush or a denture brush with some denture paste. Again, toothpaste is very abrasive, and the dentures, when they're new, are very, very highly polished, and we want to keep that polish on. As soon as that polish wears away, they become very porous, open to stains, and then that's when people start using the denture tablets more, and again, that vicious circle. So I can give you our denture care guide as well, Mark. We've got that for Sona, haven't we?
That'll be brilliant. Happy to share that. Okay, any other questions? Like I say, you can type them in, or you can just raise your hand and you can be brave and speak to Jane.
I don't bite, honestly.
Right, I don't think oh, here we are. Sandra asks if you have a sore mouth, is it good to use warm salt water?
Perfect. A few heaped teaspoons of salt in like cool boiled water, so it's hot, don't want it too hot, obviously. Absolutely brilliant. Great if you've had like teeth out, gum diseases. It's cheap, it'll really help to clean the mouth. So yeah, a real good advocate for that.
Thank you, Stacey, for that question. Okay, any more? I don't think there's any more. If there's no any more, I'm going to say thank you very much to Jane, and thank you very much for all you guys for giving up your time today. Like I say, I will be emailing. I've got all your emails anyway for when you're booked in, and I'll get Sam to send the bits and pieces out when Jane sends them on to me. If you send them direct to me, Jane.
Yeah, I'll do that now, Mark.
Yeah, and I will get an email put together tomorrow to send things out to you all tomorrow, folks. I will also be advertising. We'll be advertising some more SONA courses. I think we've got one planned in coming to Lincoln. I think it is. I think it's Lincoln, or is it Louth? I can't remember anyway.
I think it's Louth, isn't it?
It's Louth, yeah, it's Louth, and that's in this early summer, isn't it? I think it is. Yeah. So that's 4 days of further training, of which there's 1 full day on oral health and care around teeth, and that's we do. Jane brings all the big guns in, so we've so we have a proper oral dentist who comes in to support us, but we talk about discussions around people with dementia and disabilities in a lot more detail, and then we have support from the community speech therapists who talk about soft diet and swallowing, etc. But we also, the first 2 days, we give you basic tips and basic knowledge about things, be what Jane's done today, but a little bit more detail about some of the easy wins you could do. And then there's some documents which we ask you to look at. I just want to make sure that you all, as a request, make sure that each organisation should have an oral health policy anyway. That is a requirement of CQC. If you can't find one, my suggestion is you just go to the NICE website, the NICE website. You download the oral health for care homes. Even if you're from a home care provider, it's the same principles, and you just literally plagiarize it of the principles of that, and you have an oral health policy. It's as simple as that. But there's a drive, and there's been a drive for a number of years to make sure organisations do have an oral health policy. Okay. Big thank you again, Jane. It's wonderful to see you again, and I'll see you. We'll see you very shortly, because we've got a oral health community group meeting coming up, I do believe.
Yes, we have.
And for the rest of you, for the care homes and for the home care providers, big thank you for giving up your time, like I said already, and joining us again. At the present moment, we haven't got a date for the next Lunch and Learn because we haven't decided on a topic. Chloe Nicholson, who normally helps facilitate this from the ICB, she's unfortunately was pulled away to an urgent meeting at the same time. I've got a meeting with Chloe towards the end of this week where we're going to discuss what we're going to do next and what topics we want to do. If this is something you will want and you want more information about oral health, or there's some topics around especially high oral health hygiene, I'm sure that we can co-opt Jane and her team to come back again, and we can specifically look at other things and related to people either with learning disabilities or people with dementia. We can be very more specific. But the whole concept of this is we didn't really want to run into what we do on SONA in great detail, but we did felt there was a necessity of bringing best practice to the table. So big thank you for Jane for doing that.
Well, thank you for having me. Thank you, everybody.
Okay, guys, I am now going to stop the recording so everyone can breathe a sigh of relief.